Hi everyone, welcome to Karlee's farm, where I'm going to teach you a little bit about how to learn pharmacology. So my name's Karlee, I am a pharmacist by background, and I really want to make pharmacology something that's easy to learn and easy to get, so you can kind of understand what's happening. So I've got a couple of really quick and easy sort of tips just about learning pharmacology. So pharmacology is really important. It's important in most of the health sciences. Medicine's obviously a really big part of how we manage and treat our patients. And pharmacology isn't always clear. It's not always obvious that we're learning pharmacology when we're learning it. So I've got a couple of little tips to sort of help you with that. The first thing to tell you is that pharmacology is nothing unless you understand physiology. So my first tip is physiology. Now, physiology is a really, really important part of learning pharmacology. If you understand how things work in the body and where they work, then really all pharmacology is just manipulating those physiological processes to what we want them to do. So the first thing is, when you're thinking about how things work, think about those targets and where we could use medicines within those physiological processes to either enhance them or to block them. So for example, one of a really common medicine that we use in practice are a group of medicines called beta blockers or beta adrenergic receptor antagonists. And really, if you know what a beta receptor does and how it works, then when we block it, you'll understand what the effects of blocking it are. And that's really all you need to know about beta blockers. The second thing that's really important about pharmacology is learn by class, not by drug. Okay, so the second thing, learn by class. And there's a couple of really important reasons for this. One is there's a lot less classes of drugs than there are actual drugs. So you'll have to learn a lot less. So that's the first tip. The second thing that's really important is all of those medicines within that class, they all work in exactly the same way. They have the same mechanism of action. And that's really important for a couple of reasons. One, because if you understand how they work, then it doesn't actually matter which one you use. They all do the same thing. And then once you understand how they work, then the choice really depends on little nuances about those particular drugs that are much, much easier to learn once you understand the whole concept of how they work. So when you're learning pharmacology, there's a couple of really important things that you need to know. One is the mechanism of action. And again, I'm talking by class, okay? So you understand the mechanism of action of that drug class. So how do beta blockers work? Okay, there's a lot of different types of beta blockers: metoprolol, propranolol, esmolol, millions, bisoprolol, carvedilol, heaps. And you don't really need to know about every single one of those independently. If you understand the mechanism of action of that class of drugs, then you will be able to learn how they work. The second thing that's really important to learn when you're learning pharmacology is the adverse effects. Now, the adverse effects, as a general rule, are not that hard to learn. Because if you understand how the drug works, how the class works, what its mechanism of action is, then you're very likely to understand what the adverse effects are. So if you understand how beta receptors work, the physiology, and you understand that this class of drug, these beta blockers, they block those receptors, so you are reducing the physiological expectation, then what happens when we block those particular receptors? Then we get a reduced heart rate, a reduced blood pressure, and that can lead in to what are the adverse effects. So the adverse effects of beta blockers are bradycardia, or a low heart rate, and they are reduced blood pressure or hypotension. So that's pretty much the extent of it. The third thing that's kind of really important to know too are precautions or contraindications. So these things, these terms can be used interchangeably at times, but basically precautions are things that we would have to be careful about if we wanted to prescribe this group of drugs, and contraindications are particular conditions where we cannot prescribe these drugs. It is unsafe to do so. Now, once again, if you understand all of these steps, then the contraindications and precautions are fairly easy. So if you know that beta blockers cause a low heart rate, then you know that you'd have to be really careful in patients who already have a low heart rate or who are on other medicines that also reduce your heart rate. I hope that makes sense. So these are kind of the three main ways that I like to help people to understand pharmacology. And then the final thing that's important is indication. And again, you will be able to know where these drugs are indicated, in what conditions they're indicated in, if you understand how they work and where they work. Okay, so if you know that the beta receptors are involved in cardiac output, then you will know that we can use beta blockers in treating cardiac output abnormalities, for example, like heart failure. So the indication helps to contextualize all the other information, and it helps to kind of complete this circle of going all the way back again and thinking about the physiology. So all of these learnt by class are all linked into how they work and how the body works and how we can use them to manipulate our usual physiological processes. I hope that makes sense, and I hope that's helpful when you're thinking about going into learning pharmacology. So my tip is, when you're first learning pharmacology and you're first learning physiology, when you learn physiology, when you go into lectures or you're learning from a book or however you're doing it, when you think about what those processes are, I want you to think about where are the potential pharmacological targets in that process that we could use to manipulate the outcome. And as you go through that process, you'll start to really bed down some of these pharmacological classes. Now, another really important thing, and this is my final thing, so I don't want to take too long, is when you're learning pharmacology, you just have to learn it. It's just a little bit tricky, and you've got to pop it in. So this is the best way I can remind you to learn it. The other thing to think about is that you will be able to look things up. When you're in practice, when you have in the clinical environment and you come across medicines, no matter what your job is in the health system or in the health environment, you can look medicines up, okay? So there are heaps of resources that really help you to look up. So if a patient comes in and says, I am on metoprolol, then you can look up metoprolol and say, oh, metoprolol is a beta blocker. And now if your patient comes in and they say, I'm on metoprolol, and you say they're on a beta blocker, and you look it up and you say that's a beta blocker, and you remember that beta blockers work in this way, these are their adverse effects, and because of those things, I know their contraindications, and therefore I know their indications, then it just kind of pops it all into perspective for you. But it all comes back to understanding just where they work in the body and how they work based on our usual physiological processes. Okay, so that's number one. This is the first video in a series of videos I'm going to do. Coming up, I'm going to do some of this sort of style where we just talk through different medication classes. We're going to talk through their physiology because that's really important. We're going to talk about the class. This is how we're going to learn them. And we're going to talk about how they work, what the adverse effects are based on their mechanisms of action, what things we have to be careful about and worried about, and then where are they used in practice. So come along for some more mini pharmacology lectures. Thanks for joining me.